Hey guys, I'm really excited to have you all here today, and I'm really grateful that you've taken the time to commit an hour or so to yourself and to take that self-care time away from your family. And I'm really thrilled to have one of BC's top experts in women's mental health here today. Dr. Regev is a registered psychologist, a registered marriage and family therapist, and an educator. She's worked in the field of psychology since 1955, and she specializes in pregnancy and postpartum mental health and anxiety disorders. In addition to her private practice, much of her career has been spent working within the reproductive mental health program at BC Women's Hospital. And she's also worked closely with lots of local nonprofit organizations. Her devotion to women's mental health was formally recognized when she was awarded an International Women's Leadership Award. And Dr. Regev has helped hundreds of clients to regain their well-being. And I'm super thrilled to hear that she's currently working on an online project, which is designed to help women who are struggling with mental illness. And so the reason that I invited Dr. Regev here today is because, mental health is important every day. It's something that's been especially prominent, I think, during the COVID pandemic, which we're currently in the middle of. And so when I started this conversation in the Moms Gone Wild community group, I wanted to find out, sort of what issues people were facing and if it would be valuable to bring another expert in. And of course, the overwhelming response indicated that yes, indeed, having an expert here would be valuable. So thank you so much for joining us today, Dr. Regev, and welcome.
Thanks for having me. Thanks for having me. My pleasure. I do have to correct one thing, which is I started working in 1995. I am old, but not that old.
Oh, what did I say? Did I say 85?
1955.
1955. I'm sorry.
That's okay.
That's my public speaking jitters coming out.
That's okay. So so just 1995. I've been working as a therapist, and I've also taught students of psychology at UBC and other academic institutions. And I'm really happy to be here. I think it is high time to give mothers some support. So it's so much needed. And I see and hear this every day from my own clients, also family members, friends and daughters of friends, how much we need support during this unprecedented time.
Mm-hmm. Yeah, I think it's something that everybody is experiencing to some level or has experienced in the past year. It's tough, like the changes have been really hard, and the restrictions on social interactions and just almost the fear of germs and the worries and everything else. So I think it's really magnified the issues that already were present in society, and related to motherhood, I think that the same applies. Like it's just something that as you and I were just discussing before we hit the record button, it's something that is just magnifying all of these things that have already been going on.
Yes,
and so
exactly.
Is that something that you've noticed in your practice as well?
Exactly. This is something that I've noticed even in the beginning of the pandemic, let alone now that it's been going on, and add pandemic fatigue to the mix. But let's just look at challenges that mothers face even before the pandemic. Mothers who have struggles with mental health. And so we have this, the way we look at it is that there are some biological factors, there are some psychological factors, and there are some social factors that play a role in mental health for anybody. But we're currently looking at mothers of young children. So if you think about biological factors like hormones and heredity, um, those are more or less the same as before the pandemic.
Right.
If you think about factors like psychological makeup, like, for example, personality traits like perfectionism that have been linked to mental health issues of mothers. Um, these are mostly factors that have stayed the same. Maybe perfectionism and attention to detail has been magnified by the pandemic because now you have to be cleaner and uh, be sure to to have the uttermost hygiene around and social distance, excuse me, and so forth. Um, but the really major change that we see is in the social aspect of the challenges. And we all know that those support networks that we had before sometimes are no longer available to us. Let me just tell you about one of my clients, of course, without exposing her identity. But she was relying on her mother to give her support when the baby came. Now, it turns out that her mother happens to be vulnerable. And so she could not get that support from her mother when she had the baby. Her husband had to work overtime because he's in an industry that was booming because of the pandemic. So she was left to care for the baby in more isolation that we always see that isolation of mothers is a problem. And I'm going to talk a little bit more about that down the road. But with the pandemic and the limitations and the risks, a lot of women have found themselves, unfortunately, feeling completely isolated.
Yeah. Yeah, I could see that for sure. I mean, even for myself personally, like well, I run Mom's Gone Wild, which is based on, getting out and socializing and being around other people who are going through the same thing as me. And so having that connection, pre-pandemic was a vital part of my sort of mental health care, my self-care. And having that removed has had a huge impact for me. And I don't have little tiny kids anymore. Like mine are 3 and 6. And I still
Right.
find that, just having that time away from home in another space where I don't constantly have the label of being a mother is so important. And now it's hard because, like you said, like we rely on our parents or my in-laws to watch my kids, and they too are at higher risk. So we aren't
Right.
at risk. And yeah, it's hard because then,
Yes.
we don't have childcare and somebody has to be here all the time, right?
So. And I think that Moms Gone Wild is a wonderful initiative, and I really applaud you, Cheryl.
Thank you.
I think it's the best for mom to have a little bit of time for themselves, away from their duties and away from kids that we love to pieces.
Yeah.
But sometimes you just need your own space. But even other forms of support, like, for example, I frequent a certain coffee place in Vancouver, and I used to look at groups of moms that would come in with strollers, with their toddlers and babies, and would just sit around and chat and laugh. And if one of them had to go to the bathroom, she would hand over her baby to one of her friends there, and she would have the privilege of going to the bathroom without the baby.
Yeah.
Right. And I look at that place right now, and it pains me to see that they're not coming anymore because you're limited in the number of people that you can see.
Yeah.
So our lives have been upended, everybody's lives, right? Everybody's life. But mothers seem to be in a place of bearing a lot of the brunt for the changes that all society has incurred by the pandemic.
Yeah. Yeah.
Yeah.
I definitely feel that.
Yeah, and I want to say something else that I keep hearing from clients of mine, that sometimes when they are not in the best shape and they complain to someone about how they're not doing so well, uh, people may be not as empathetic as before to them,
Right.
because they would say something like, oh, but everybody's in the same boat. So why are you complaining? Why is it so difficult for you? And what I say to that is, we're not in the same boat. You know,
Yeah.
we may be in the same storm,
Yeah.
but we're not in the same boat. Some of us have big boats, new boats. Some of us have small, wanky boats. Some of us have luxury yachts. And some of us are barely hanging to a makeshift raft
Yeah.
while trying to help our helpless kids with us. So we're not in the same boat. So let's be more forgiving toward ourselves and toward mothers who are struggling.
Yeah.
It's not it's not a shameful thing to be struggling. This is really hard.
Yeah. Yeah. I don't know if you saw, but yesterday I posted on social media, how I had struggled back in the springtime. And I didn't speak about it publicly, which normally I think I would have, but I just felt like what I was going through at the time wasn't as bad as what other people might be going through. And so I think I was comparing my boat to other people's boats and thinking like, well, my boat, it may be, a bit stronger than the person who is on the raft. And so
Right.
therefore I wasn't as fast to seek help. And I think that's something
Mhm.
else that we're seeing right now is mothers wanting to care for everybody else and thinking, well, my situation's not that bad. So they're kind of
Mhm.
pushing it down when, they ideally we would recognize that,
Right.
that
Right.
just because it's not like the maximum amount of help that anybody ever needed, it doesn't mean that we shouldn't address it, right?
Right. And I just want to add that sometimes mothers have to take care of everybody else, whether they want to or not.
Yeah.
For example, when we had the kids at home, let's say mother was planning on one kid being in school, one kid being in daycare, and then she was having a baby, and then she finds herself caring for the three at home and making sure that her eldest is getting what they need through via Zoom, and the toddler needs their attention and time and affection. And these are all activities that mothers love their kids and they would do anything for the children. But these activities, day in and day out, are really draining.
Mhm. Yeah.
And so you find that at the end of the day, and especially when it seems to be never ending, it is ending at some point, it will
Yeah.
end, but right now it's hard to see that. Um, that depletion and that need to give out of an empty container
Mhm.
is what's taking a toll on mothers.
Yeah, for sure.
Um, and as I said, things that I've been doing this kind of work for over 25 years. So before the pandemic, obviously, and mothers having to give out of an empty container is not new.
Mhm.
But what's new is how much moms have to give now out of an empty container.
Yeah. Yeah, I feel
Uh,
that myself. I feel like even if I fill my container up, it drains way faster. It's like those resources are just used up so much quicker.
right,
But
right,
do you
yes.
have suggestions for how we can try and fill that container and maintain it at a higher level than I guess for me too have been doing
Yeah.
for the past year?
Hmm. It is tough. The situation is tough, especially when the person you're with, whether it's your partner or you're single or you have some help, um, how much support you can get from others around you. Support of, for example, a partner, a life partner. I'm not sure that people are aware of this, but support is um, so important for the mental health of mothers who are struggling with mental health challenges, so much that it can make the difference between levels of depression, for example, or whether a mother is clinically depressed and anxious and non-clinically depressed. So the support that women get, a lot, I get this from a lot of partners who are saying, what can I do? I have to work. I have to provide for this family, and not to be gender biased or stereotypical, but it so happens that in about 85% of households, the male is the breadwinner or the main breadwinner, and the woman is the caretaker. And it has been magnified in the past year or so, even more.
Right.
And what I've been hearing from moms is that even if she's holding a job and, and also taking care of the kids, the expectation is that she's going to take care of everything that has to do with children and household. And I'm not saying it's like that with every household. I do know households where the male partner is more involved and shares duties and responsibilities. But I happen to hear a lot from women, and so and maybe that's my bias because of the population that I work with. I do work with couples, but mostly I see women. And what they're talking about is that no matter how much more is on their plate, they are still expected to carry what we call the mental load.
Yeah.
And not just the actual chores and childcare responsibilities, but the mental load, which is knowing that you have to take your child to the dentist.
Yeah.
Not even things that sometimes don't occur to the non-mother partner.
That's why I'm laughing. Like my husband would never think of that. Like it's almost like a given that falls on my plate, right? And like he's
Right.
very supportive. I don't want to throw him under the bus here, but it just feels like something that's just kind of always naturally fallen to me. And scheduling their activities and figuring out how they're going to get to the activities,
right,
and figuring out what are they going to take for lunch, and do they have shoes that fit them, and it's just
exactly,
like constant,
and
just,
knowing that if they're going to soccer, that they need cleats.
Yeah.
Right, goes without saying, but in some cases you do have to mention that. And again, not all men are oblivious to what's needed for the family, for the kids. And I personally know, I mean, I have a son-in-law that I admire. Yeah. And he's going to be the one who says Leahy needs boots because her boots are too small for her. So kudos to Yuval. But I also know a lot of men who just see their role as the breadwinners. We're in the 21st century, and it seems like it shouldn't be happening anymore, but it actually does. And especially when there have been all kinds of adjustment in the work and the breadwinning division in households because of the pandemic.
Yeah.
That's put more on men right now. Yeah. And I know that if men are watching, they're going to say, but what about the stress that I have to provide for the family? And that's a very valid concern. And I really don't think that most people are not lazy or trying to get away from their duties, but most people are struggling.
Yeah.
And so,
well, I think we're in crisis mode now, right?
Yes.
So any kind of, steps that we've taken to maybe move forward and progress and get some of these things off of the women's plate. I think once we entered crisis mode, just kind of defaulted back, and it almost stepped us all
Absolutely.
back. I know for sure that's the case in my family. Like
Mhm.
I'm homeschooling now, and I'm not upset at my husband because he of course has to work and has to pay for us, right? It just is the way that it
Exactly.
is for us. And so how
Exactly.
can we, like, are there things that we can do,
Yes.
on our own personal levels to try and,
Mhm.
I guess it's almost delegate some of that mental load, right?
Absolutely. Delegation is very important. And before people jump at me and say, well, we're trying to delegate, but the other person is not taking on the tasks, I suggest that each one of us sits down and thinks about what are some tasks that they're taking upon themselves, believing that they would be the best to do those tasks, to perform those tasks, that if they don't perform these tasks, but they delegated, that it would not be done in a way that would be sufficient, let alone perfect. So I encourage women who are feeling the burnt out and the pandemic fatigue, and this has been going on for too long. And I have a word for Dr. Bonnie Henry as well, and I'm actually writing her. I'm in a group of mental health workers who are going to address. I don't think that the mental health aspect of the pandemic has been addressed appropriately. But delegation or things that you must do yourself.
Right.
Breastfeeding, yeah,
Yeah.
cannot delegate that. I agree. But a lot of other things can be delegated if we just give up on our need to perform it in a perfect way, because we think that if it's not performed perfectly, then it's going to damage our kids. Kids are
Yeah.
resilient,
Oh, totally.
right?
And that's so true. And I think the other side of that, or something else that adds into that, is that I've experienced is the fear of judgment. Like, I think when I became a mother, I thought I had something to prove to the world. And as the years tick by, my own standard of myself goes down. And I wish I could go back and tell who I was in the beginning. Like,
Yeah.
you're running yourself ragged for what? Like, I think, have this fear of judgment inside of us because society kind of
Hmm.
puts motherhood on this pedestal, and
Right.
it's almost like we're trying to achieve this level of perfection that really doesn't exist.
Right.
And so I
Right.
think a lot of that is the delegation just comes down to, like you said, us being willing to let go and to
Yes.
take the time to find the solutions that could exist.
Right, right, absolutely. Judgment, and the worst of all judgment is self-judgment, is
Yeah.
when you look at yourself and judge yourself to be inadequate or not good enough or not perfect, because nobody is perfect, but you could be perfect, right? So you wouldn't expect perfection of anybody else, but you expect perfection of yourself, and that is like shooting yourself in the foot, so to speak. And you need to lose that, right?
Yeah.
So that, I would say, is one thing. The other thing is we lost a lot of our social support, but we can still have some social support. And what I'm going to suggest, I think a week ago wouldn't be acceptable to Dr. Henry, but I think this week it will be acceptable even to her, is to find one friend or two at the max. Friends that you do get together with, no hugging or kissing, but you do get together with for a socially distanced. I don't care if you keep your masks on, but that you do take a walk with, you do even go get a coffee with. I did something with a girlfriend of mine who We went down to the beach, each brought her own coffee. We were sitting in our cars in the trunk of our SUV, and her in her truck and me in mine, and we were having a chat.
Yeah.
And when you do something like this, it fills you up.
Yeah. It does.
True, we would like to be sitting together close by and hug each other when we see each other and hug each other as we part. That's not possible, but other things, if we adjust it a little bit, then we can still get that support. But I have to say that you can't meet, Joanna that day and Iris that way and Susan that way and Margaret that way that day. You need to pick one or two and just socialize with them. And if you're going to do that, pick the one where uh, after you interact with them, you do feel supported. You do feel like your container is a little bit more full. So if you choose one and she's the one that always needs help and kind of drains you further, I mean, you can do a little bit of that, but it can't be everything that you do. Okay?
Yeah, it's
Because you
almost,
need,
yeah, you need to find, I think, something right now that could be mutually beneficial, right? Where, because I do find
exactly,
there's value in helping somebody else too, that fills me up as well. But if there's a fine line there, right, between
right,
filling somebody
right,
else up and depleting, dumping your whole cup into theirs, right? So,
right. So you have to take care of yourself. I think that one of the important things, as I said before, is to get um, the support, but also permission.
yes,
Permission, and the permission I think you have to give to yourself.
yeah,
If I could, I would give it to each and every one
yep,
of you. You have permission from Dr. Regev to take care of yourself. And not just permission, it's the responsible thing to do.
yeah,
It's just like you, when you go on an airplane, you are asked to put the oxygen mask should the air pressure drop down and the masks are going to come. You are asked to put one on yourself before you can help anybody else. And we all obey by that rule. Why? Because we understand that if you're out of oxygen, you can help nobody. Well, this is the same.
yeah,
If you're not taking care of yourself, then you're running on empty. And if you have to give, like you have to give to children and babies, they don't care, right? They need what they need, right? But
hmm,
then you're putting your hand into your empty container and still giving out, and then you're paying the price of your mental health. So
hmm,
you do need to give yourself permission. And I'm not talking about big things. I'm just talking about can you spare 15 minutes to yourself during every day when you're not doing anything for anybody else and you're not even responsible for anybody else?
hmm,
Sometimes how sometimes moms, when they have a baby and it's their nap time, oh, but I have my time because the baby is napping. But you know what? Psychologically, you don't have space because you are on call. When
right.
the baby's napping, you are still on call.
That's
So
so
you
true. Yeah, you never know when it's going to wake up and you're going to need to spring into action, and you're trying to do
exactly,
yoga or read a
exactly.
book. It's like, oh man,
Yeah,
and
and you
nap
don't
is
know how
nap.
many women tell me um, that mental health caregivers are telling them, okay, nap when your baby naps, right? And then they say, but by the time I will fall asleep, they're going to wake me up with a shriek, and then I cannot calm myself down enough to fall asleep. So I cannot nap when my baby naps. But what can you do when the baby naps? Maybe somebody else can watch them. Maybe if your husband is working from home or you have somebody else around, they can watch them. And if you don't, then your time needs to be another time.
Hmm,
Maybe when somebody else is home with you,
hmm,
right? But when I talk about the 15-minute time for yourself, what are you going to do rather than fret about what you're not currently doing, right? Oh, I could be doing the dishes, I could be packing lunches, I could be, instead, Dr. Regev said that I should sit down and just be. Okay, so that's familiar, and I'm not expecting you to do that, but so I don't know how many moms are familiar with meditation. And again, when I say meditation, people are like, oh, meditation, I don't know meditation. Meditation is so complicated. I can't possibly empty my mind of any thought. That's never going to work for me. Well, meditation is not about emptying your mind. It is about noticing, and it's about being in the present. And there are pretty good ways and quick ways to get into that. And one thing that I wanted to surprise you with, Cheryl, because I appreciate so much the wonderful work that you're doing, is that I'm going to give one of my videos to your group members for free.
Oh, that's so kind of you.
And so, because I really want to help. And so that video is going to be on how to find your special place in your mind, in your own mind, with my guidance.
Oh, I love that. Mindfulness and meditation have been so helpful for me in my journey. People who have been in Moms Gone Wild for a while probably know that I experienced pretty severe postpartum anxiety after having my second daughter, so about 6 years or so ago now.
Right.
And up to that point, I was the same as you described. I was like, nope, meditation's not for me. Like, that's just, some weird, crazy thing that other people do that I don't have time for, and that I just can't get there. And what I didn't realize was all the different strategies that could entail.
Right.
And that it can be as simple as just being in the present moment, as you said. And once
and noticing your breath, for example. I mean, you're always breathing, and notice how often do you sit down and notice your breath, and how do you do that in a way that doesn't make you more anxious. So there are ways to do that.
Beautiful. Well, your video, I'm sure, is going to help many, many people. So thank you.
Sure. I know it has already, and I'm sure it's going to be, if it's being used, it's going to be helpful. So one thing I wanted to tell you about before we end is that I have been, and all of my colleagues, we have been flooded with requests for help. I don't know if you've heard the statistics, but basically we have threefold the number of people contacting mental health resources for help since the pandemic started. So I've been thinking about helping more people in more ways. And for 25 years, I've been mostly doing clinical work one-on-one or with couples. I also have been teaching counselors and psychologists and so on. So I'm very familiar with the teaching and education. So I was thinking, how do I help more women, more people, but mostly mothers of young children are very close to my heart. And that's because I used to be a very young mother with very young children, and I wasn't doing well. So you mothers are close to my heart. And thinking about helping more moms and more women who are struggling with mental health issues. I've established a Facebook support group. That's one thing that it's called Dr. Regev's Anxiety and Panic Support Hub. You can find it on Facebook, or you can post a link, Cheryl, on your group.
I'll post a link below the video in the comments section too, so people can
see. And then the other thing that I've done is I've developed some materials that people can look at, can read for dealing with mental health issues. So I have a mini course on panic. I have lots of videos that have techniques, powerful techniques to help with anxiety, panic, stress, and so on. And I'm making those available to people at a very low cost,
That's
just
so
to be
great.
able to help as many people as possible. And by the way, a word about that, there's a cost involved in those materials, but if a certain woman cannot afford to pay, then there's a form that she can fill out, and we'll get her a stipend
Oh, that's so
for
great.
the materials, because I really want to help.
That's so generous of you. And I just wanted
Thank
to
you.
comment on how you said that, the need for mental health supports has increased threefold since the pandemic. I mean, that doesn't surprise me at all. It hurts my heart, of course, but it doesn't surprise me. And at the same time, I just want to acknowledge the fact that there hasn't been, three times more counselors all of a sudden go through. And already the system
Yeah,
was overloaded before the pandemic. Like, I've been doing Moms
right.
Gone Wild for 4 years now.
Yes.
And something that I've heard from the beginning is, once I recognize I need help, I don't have access to it. And it's a matter of, moms not being able to afford it, or not even be able to find it, not be able to get in somewhere. The wait lists are too long. It's
Yes.
something that I've advocated for through Moms Gone Wild to our local government, and I'll continue to do as well, because I don't think that it's fair. I think that they should be stepping up. But it makes me feel a lot better
Absolutely.
to know that people like you, who are doing what you do because you are passionate about it and you've walked through the same sort of journey that we're on right now, that you're willing to give a part of your time and your effort and your expertise away, is just like, you have my utmost respect.
Thank you,
That's
Cheryl.
such a huge gift that you're giving the community,
The
and
feeling is
I'm extremely
mutual,
grateful
as
to
I
have
said.
met you. Yeah.
Thank
So
you. Same here. Thank you. And we're going to do this again, and we
yeah,
are going to incorporate more questions. Today, I think we attempted to touch upon some themes that have come up from the questions that your members, group members have brought
that's right.
forward.
Yeah. Yeah,
And
there's
then
such a
we know that we have other things that we haven't had the time to touch upon. Um, I don't know if you want me to say a few words about medication.
Sure, if you'd like to. A couple people asked, so if you want to do
Mhm,
that, that would be great. And
mhm.
yeah, I just want to reiterate that I appreciate everybody's comments coming in and their questions and sort of voting on the polls. And I do want to acknowledge that we weren't able to get to all of those today. And it's
Right,
important to both of us, though, that we do keep the conversation going. And so
right,
you didn't answer them today, you were still heard. And we're putting together also, I'm putting together a blog post, which Dr. Regev is helping me to compile a list of the resources that are available, which I
right.
will include all of the things that she's talked about today, as well as other ones that are available. And I think I'm going to only include the ones that are free on there. So,
Absolutely.
otherwise, though, yes, please talk about medication, because it was important to.
Yes. So we had a couple of questions about medication during pregnancy and postpartum. So I would like to say that medication is one of the treatment modalities for anxiety and depression during pregnancy and postpartum. We have more and more knowledge about medication, about side effects, risks, and so on. I just want to mention one thing, kind of suggest a shift in the thinking about medication, because having worked at the hospital, women's hospital, at a psychiatric, the mental health, reproductive mental health program, I used to hear a lot about when women were raising the question about medication and is it safe. I used to hear women being told that you have to weigh the risks of medication versus the risk of not treating the depression and anxiety. And I personally think that this is totally faulty paradigm and equation, I think the issue of not treating is not even an option. You have to treat, you have to give attention, you have to give support. And medication is one of the ways, but it shouldn't be presented as the only way to treat, because it's simply not true. We have a huge body of research that indicates that, for example, cognitive behavioral therapy is as effective as antidepressant medication to treat anxiety and depression, especially in the mild and moderate levels, but also even in the more severe cases of depression and anxiety. It is a choice. It should be available, but I think that it's mandatory that women will have all the information and that they're not given an answer that says, oh, you're reluctant or hesitant to take medication, but what are the risks of you not being treated? That's just not right.
Right. Yeah.
Okay. So I'm not against medication. I just think that medication should be one of the options, and you can combine medication and therapy, because medication, for example, doesn't take your social isolation away.
Yeah.
It doesn't take conflict with your partner away.
Yeah.
It doesn't take past trauma away. It may help you to cope. But some certain issues need to be dealt with in therapy.
Yes.
So,
I could not agree with that more from my own personal experience. I'll just give a bit of background on that because I think people will be able to relate to it. When I finally realized what I had was anxiety, or I had mental illness, and I went to speak to my doctor about it. I was essentially given what you just spoke about, two options, take the medicine and feel better, or don't. And I think that that's really common in our medical world, and that there has to be some work done on that end. But it was really hard because I felt like also there's a stigma surrounding medication, right? And there's a fear that, you're going to do harm to your child or whatever. But over time, I ended up doing cognitive behavioral therapy, as well as I did go on medication. And that was a choice that I decided to make eventually. But it was both of those tools together were so important for me, and not just those two tools, but a host of other things like the mindfulness we spoke about, and learning these tools from the therapist that I ended up being in touch with were just, they were so key for me. And so I think another important thing to say to the moms is, if you've tried something and it hasn't worked for you, don't stop trying, because I've been there. I've tried things that have worked for other people that they recommended to me, and they didn't work for me. But eventually I did find the right sort of formula for myself.
And I'm curious, Cheryl, how did you move from believing that you either treat it with medication or you don't treat it, to learning that there are other ways?
Yeah, honestly, I met just I am so grateful to the therapist that I met, and she helped me get through that. But ultimately it was my own knowing. Like when I went to my doctor's office that first time, I mean, I was just comprehending the fact that I had mental illness. I come from a background, a family who we didn't speak about it, and I'm not, like being negative about my parents at all. I think it just wasn't it wasn't a problem for them. So I wasn't educated on mental illness at all. So I was really wrapping my own head around, oh my gosh, I have mental illness. And then the thought of right away, just this medication that I knew nothing about, it terrified me. But as time went on, and I put a lot of effort into, I was going to weekly therapy sessions, and I was doing all these other things. I just knew it was time for me, and it felt right. And when I went on it, I went into it with a good mindset, and I didn't feel like, I don't know what the word is, like I was sort of like giving into it. Like I felt like it's time to utilize this other tool that's there for me. And that period, I didn't just, take it and stop doing everything else. I used it as kind of a crutch to carry me on with those other things. And then eventually I came off of it, and still utilize those other tools. And in a lot of ways, I'm grateful for that journey, because I've gained a lot of tools that have helped me in a lot of ways that I didn't realize that I was suffering in the past, or not suffering, but not sort of, like things that could be addressed that I didn't even realize through that process. So
Right,
in
right. That's
hindsight, I see the
wonderful.
journey as a bit
Yes.
of a gift, but sort of in the thick of it, of course, it doesn't feel that way, right? So
Right. And when you're in the thick of it, it feels like there is no end, there is no light at the end of the tunnel.
no,
Not only remember or see the light at the end of the tunnel, but you can't fathom that there is one at
no,
the end of
that's
the
exactly
tunnel,
right.
right? And when you're in the thick of it. So there is light at the end of the tunnel. That's what I want to say to everyone. And there is a way to absolutely recover from mental illness. And we're here to help.
Yes. Yeah. That's
Mhm.
exactly right. Well, thank you so much for being here today. I think that's a good note to leave it on. And I'm looking forward to talking to you hopefully again at the beginning of March.
Same here. Thank you very much for having me, Cheryl. And thank you. And may everyone be well,
Yeah.
please.
Yes, agreed. And for anybody who wants to stay in touch, I'm always posting mental health related things on Mums Gone Wild and sending out emails. So you can touch base with us there. And you're always welcome to send me a message about any concerns you have. So thank you so much.
Thank you.